Hi, welcome to Age Well with Joy. I'm Joy Paith, the CEO for AgeSmart Community Resources, your local area agency on aging. So many of you know that AgeSmart offers a great deal of services for older adults. And along with that, we also provide supports for family caregivers. And today I'm excited to be here with Robyn Kessler, one of our caregiver specialists, and Tabitha Mays, who is one of our information and assistance specialists. They're going to talk a little bit about a challenging time that many caregivers end up having to cope with and live through, and that would be an emergency room visit or a hospital visit. So Robyn has some experience working in hospitals.
I do, yes.
So if you can talk by talking about how you can make your emergency room visit simpler for your loved one.
Yeah, absolutely. So we know going to the emergency room is a very stressful time, not only for our loved ones, but for ourselves as caregivers, because we're allowing other people to care for our loved ones. But it's very important to remember to advocate for our loved ones. So keeping a health journal or a diary at home, something that is simple for you to either grab as you're running out the door, or keeping it on your phone or your tablet or some kind of electronic device that you have with you. Writing down questions that you might have. When they're not in the room, write those questions down and wait for them to come back into the room, because they might be with another patient, and when they come back in, they will give you all the time in the world as long as you just ask them the questions then and there. Respect their time. They will respect your time as well, and just advocate for your loved one when you're there with them.
I think it's so important because that person is so busy and they don't know who they are as a person. So having that little booklet, whether you spend 85 cents on a tablet to put that information in, and AgeSmart actually can help you with some medical journals that you can put in a drawer that you can pull out in a time of an emergency. So if your loved one has to be admitted to the hospital, can you talk a little bit, Tabitha, about the difference between hospital admittance and observational status? Because that's really important and there's a significant difference.
Sure, it is a very significant difference. You need to know the status of your loved one, if they are admitted into the hospital or if they are there for observation, because Medicare is going to pay for it differently, and who pays for it is going to be differently. Is going to be different. So definitely it's important to know their standing in the hospital.
Great. You don't want to be stuck with, oh my goodness, I had no idea, or having to go to rehab and it's like, well, how come rehab's not paying for it?
Right.
So that's critical. So everything's gone well. They've been in the hospital, they have recuperated, and now they're going home. So how does that discharge process look, Robyn?
So when the time of discharge happens, or before discharge even happens, there's discharge case managers that work behind the scenes. They're also going to work with one of the grantees out in the community, one of our grantees, which is the Southwestern Illinois Visiting Nurses Association. They send case coordinators into the hospital. It might be, unfortunately, at a time when a caregiver is not there, because we never know when they're going to get there, as they see a wide variety of people. And they're going to conduct what is called a choices screening. With that choices screening, it's going to determine whether that individual is safe to go home with resources such as in-home help, or if they need to go to rehab or a long-term care facility, which is also known as a nursing home.
So if they do end up going to rehab and they've been in the hospital under general admittance, how long does that last for their Medicare payments, and how does that get paid for?
For Medicare, it needs to be a Medicare approved rehabilitation center. So make sure that you're going to a place that takes Medicare. Your family loved one needs to be admitted into the hospital for 3 days. It's 3 midnights actually. So they don't count the day that they come, and they don't count the day that they're discharged. So you have to look at it as 3 midnights. Once they've been released from the hospital and they go to the rehab, then you have to pay the deductible first. And then from day 1 through 20, Medicare will pay all of it. And then days 21 through 100, you have a daily copay that you have to pay. And then if you go past 100 days, then it's all the beneficiary pays for all of it.
Okay, so that's key to know.
It's important, yeah.
And then there's a different type of rehab in a hospital, and can you talk a little bit about swing beds?
So some hospitals in our area have a unit called a swing bed unit, which is just you're staying at the hospital. Some places have them just mixed in with the patient room. Some of them are a special unit. It's just an opportunity to continue to stay in the hospital specifically for rehab purposes.
So, and you have choices on where you go, so you don't have to use the suggestion of the hospital discharge planner. Sometimes you don't have time,
Right.
and sometimes people don't have room in their rehab facilities. Can you talk about how you can help as a caregiver specialist with that?
Certainly. So I can always provide you a list of different facilities in the area, explain the differences between inpatient facilities and how rehab might look different in a long-term care setting, as well as what questions to ask. And sometimes it's also helpful to know why your loved one is in the hospital. You know, for example, let's say it's a stroke. There are some facilities out there that their goal is strokes. They help everybody, but their main goal is helping people with strokes. They have wonderful equipment specifically for those diagnoses to get their loved ones home.
And then when they do go home, if they're home for a certain amount of time and need to go back to the hospital again, and we see this a lot because a lot of times the person is pretty frail. So talk about how long they can be home before that whole system starts again with the 100 days, the
Right.
co-pays.
Right. If you have been released from rehab and you are home, if you are home for 60 days or over and you go back into the hospital, it starts a whole new coverage date. So you'll start from day one again, and you'll pay the deductible first before Medicare, starts to pay their portion. And there's no limit on how many beneficiary, how many periods you can have. So it's like if you do the 60 days every time, you start over from day one every time.
And we see that happen
Yeah.
too, don't we?
Yeah.
So if you had one piece of advice, let's start with you, Robyn, when your loved one's going into either emergency room or hospital stay, what would that be?
Advocate, 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 and don't be afraid to call me if you have any questions or because you don't know what you don't know.
Right. How about you, Tabitha?
Ask questions, ask billing everybody, what's going on, what is the status, ask everybody so you can continue the process of as they go home or, go into rehab. Just knowledge is, everything you can know is better.
And remember, you don't have to remember everything. That's what we're here for. All of the services that AgeSmart provides are a donation-only basis. So give us a call. This is why we're here. We exist to help you and to help people age well. So thank you guys for joining us today, and thank you all for listening.